Good Monday afternoon. I'm Tre Tailor, and welcome once again to Coping with COVID updates and information to help us with this new pandemic that we're dealing with right now called the coronavirus. I'm Tre Tailor. Today, we're going to talk with Dr. Nicole Edwards. She's going to give us some updates about the coronavirus, new symptoms, and also the dangers of going too much too soon. And already, Nicole, thank you so much for joining us. We know that our governor has opened up a little bit. A couple of weeks ago, it was the boating, the landings, and all of that, and then now some retail businesses are opening up. What are your thoughts about that as a physician?
Hey, Trey, thanks so much for having me again. So there's so much going on. My thoughts as a physician, we're doing a little bit too much too soon. So if you even look on a federal level, the president outlined some guidelines for when to open up.
He wanted 2 weeks.
2 weeks, so 14 days for everyone that can count. 14 days of a decline in testing, a decline in positive tests, right? Last I checked, which was, I believe, this morning, as of yesterday, we still had 183 new cases. So that's not quite a decline yet. That's actually we're still going up. So, and I saw on one news channel, they were talking about there's 3 different ways to test. You can test the actual number of tests that are coming back, from like the CDC. You can test, you can count how many new cases we have in terms of hospitalizations. And there was a 3rd way, but none of the 3 ways has South Carolina met the criteria yet. So technically, we're not even meeting the federal guidelines in terms of reopening. So I'm not quite understanding why we're reopening so early. And I get it, right? The economy, the small businesses, people are hurting. But I have a feeling that if we open too soon, which I do think we are, we're actually going to see our numbers go up, and we're not going to see this get better faster. It's actually going to be prolonged, unfortunately. And then I think it's just not a good idea. My mom always says, just because you can doesn't mean that you should. And that's been kind of what I've been telling my patients and telling, my followers is that just because they're opening things up doesn't mean we should. Here's another thing that I pointed out is that if you notice some of the states that are already opening up, they happen to be some of the states that are in the poorest areas in terms of healthcare and in terms of what healthcare disparities and also healthcare conditions. So South Carolina, we are actually, unfortunately, we are the number, I believe it was 43 on the healthiest states, right? And or so we're down in the top, in the lowest 10 for the states in terms of how poor our health is.
Is Georgia down there too?
Georgia was number 36, and we were number 40, and then Florida was number 33. So 33, 36, and 40, and yet we're the first 3 states to open up. But if you also look at it, we are in the bottom 10 in terms of the economy, and so in terms of what was the word I was looking for? We're in the bottom. Okay, we're in the bottom. So, but the health care disparities. So disparities meaning we have the highest number of diabetes. They have the highest number of the metabolic symptoms, so diabetes, hypertension. Actually, Georgia has the highest number for asthma in the United States. So that's odd because asthma is one of the main risk factors for having problems from COVID-19.
Because it's respiratory.
Right? But so I don't quite understand why and their numbers are not going down yet either.
Yeah.
But, we know that people that have chronic medical conditions can get the symptoms worse than the people that don't. And so I'm like, how are we in the lowest? We are the sickest state, but we're opening up first. It doesn't make sense to me. It just doesn't make sense.
Dr. Tasha Boone was on Coping with COVID on Friday. She did a tutorial on masks. And one of the points that came out, and I made it, is that my other concern is that, okay, so we're one of the states opening up. Our neighboring state, North Carolina, hasn't opened up. Their governor has chosen not to open up until May 22nd, as a matter of fact. Kudos to him. But that doesn't mean that North Carolinians won't cross the border to come and patronize us. South Carolinians will, I'm almost sure there were some people from South Carolina that went to Georgia this week to get their hair and nails done and to get a haircut.
I absolutely guarantee there was.
Yeah. So what that means is now South Carolinians going to Georgia, they're coming back to South Carolina and bringing that, whatever they got there. North Carolinians coming from North Carolina, coming to South Carolina, bringing what they have. So now we're talking about, again, cross-contamination or cross-infection, whatever you call it. Yeah.
Right. Exactly. And so I don't see how.
Which can't do anything but make our numbers go back up.
Make our numbers go back up. Well, they're not going back up. They're just going higher because we haven't gone down yet, unfortunately. So just the safest thing to do is to stay at home. Right. And it's not safe, folks. It's not safe. And I get it. Like I said, I'm a small business as well. So I understand that people want to patronize the small businesses. We want to get the economy back going.
People need to work. You know,
people need to work.
People need to work. There was I think I mentioned this to you off the air. There was a State House press conference today of some people from hair salons and some other Republican senators that were proponents of reopening the state because they say that, you know, we need it. The economy is bad. Also, they talked about the fact that the hospitals are laying off people because new people aren't coming in. You know, people are hesitant about going into the hospital and getting treated. I mean, there's great points and arguments on both sides.
Right.
Absolutely.
Right.
Absolutely.
But the key is, we have to follow the studies and the science, and we have to follow the numbers, right? So I'm all about treating people and not necessarily numbers, but you have to look at the numbers and look at the science behind it. And it's just, as long as the numbers are going up, it just doesn't make sense to me why we are opening up things. It's from a safety standpoint. I can't go and get my hair done without my hairdresser being right here in my face, right? I can't get my nails done without the nail tech being right there in my face. And we can all wear masks, but still we're also having to touch the chairs and the everything. It's just, it's too soon.
So Nicole, do you not think that in the instance of hair salons, nail salons, even with gyms, that enough sanitation could be done between clients to make it all right? Just asking.
Could it? It could, but will it? Probably not. And then it's not just about the sanitation, it's also about people, right? And so is everyone going to wear a mask? And you have to make sure that everyone is doing the same thing. And the problem is that we're not all doing the same thing in terms of precaution. So, I drove past Walmart the other day, and maybe half of the people had masks on and the other half didn't. So until something becomes mandatory, then people aren't going to listen. And so I've even heard of a salon that's opening up. She says she's going to wear a mask, but she's not going to require her clients to wear a mask. And I'm like, but how?
Right.
That doesn't make any sense. Like everybody would have to wear the mask. Everyone would have to sanitize. So for example, even here in my clinic, I have some rules in place. If you are coming in, you can't bring any family or anybody in with you. They have to sit outside. And then if I'm trying to spread my appointments out, but if I come out to get you from your car, like there's nobody sitting in a waiting room, because I don't want, and then in between each patient, I am completely cleaning down the whole place. And then I have to let everything dry for 10 minutes, right? Because the cleaning supplies I use, it has to be wet and then it has to dry. And that's how, but I don't know if everyone's going to do that, and it's just, the risk is still too high, and I think we're moving too fast.
Queen Shannon Nicole says, well, hello, Dr. Nicole Edwards. And, well, hello, Shannon. I'll have to say hello to you, too. She didn't say hi to me, but I want to say hi to you, Shannon. And congratulations. I just found out she was engaged. So anyway.
Congratulations.
So, all right. So you're definitely a proponent of waiting. You're a proponent of waiting. And,
And then because we also are still seeing, like I saw all the pictures this weekend of all the people at the beach. And I'm like, what are you all doing at the beach? Or all the people who are having parties. And I'm like, what, why? Yeah. Why? It's too soon. And I get it. We're all going a little stir crazy at home, but it's too soon.
Yeah. Barbarita Springer says hello also. Ladies, thank you so much for joining us for Coping with COVID. This is Dr. Nicole Edwards. She's talking about the latest coronavirus updates, also the dangers of too much too soon. And that's what we're talking about now, too much too soon. So, Nicole, I don't know if we can stop the opening of the economy. I think the lawmakers are going to, I'll say, maybe buckled into or fall victim to people complaining. There's a big contingent of people that are complaining. There was a protest, a drive-by protest on the State House over the weekend, trying to urge the governor to open up. And of course, everybody understands that people's businesses are at stake. People want to get back to business. They want to provide for their families. So what do we need to do? We know what the dangers are of too much too soon. What happens, because we can't avoid it. So what do those of us who feel like it is too much too soon need to do?
Right. And
to stay protected.
Right. And I do want to give a little bit of grace to our lawmakers and to our people who are above us, because we've never dealt with this before. So nobody knows what's going on. We're getting new information every day. And you're kind of, I would say, darned if you do and darned if you don't. You're not going to make everyone happy on either side of the board. So I do want to not look like I'm coming down, really harshly on them. We kind of dealt with the same thing with pastors and churches a couple of weeks ago with should they shut down or not. It's hard to say, right? And there's no completely right or completely wrong way on either side. But my whole thing is safety first. So what do we need to do? Well, first of all, you can support these small businesses, but just try not to do it in person. So if you are wanting to support, like, some of the restaurants, even though they are open the doors to go in and eat, I don't think you should go in and eat because it's impossible to eat while you have a mask on and then remove your mask and then eat and then without touching your mask, then you're contaminating and cross-contaminating. So you can still support these businesses. You can go in, order online. Hopefully they have online ordering and you can get it and then take it home and eat it at home. Same thing with some of the other businesses in terms of, if there's a mom and pop store that offers, I went to go and get some things for my garden to plant for my garden. And I tried to go to a local mom and pop store to buy some seeds and stuff. You can call and find out, hey, can you bring the seeds out to my car? And then they can put it back in the back in your trunk for you, without, so you're not ever touching. Same thing with some of the other businesses, right here in where my clinic is at, there's a game place. They do the same thing. They'll bring the stuff out to you. So just finding ways around. Now, I don't know how we can make that work for hairdressers and salons outside of maybe they can teach a class online on how to do your own hair or something. I don't know. But in terms of the places that are open, we still don't need to rush too soon. Now, if you are going to go in, you do need to wear your mask, right? And of course, that is more protecting others from your secretions and your coughs and your sneezes. But if we all do that, then we'll all kind of be protected a little bit more. You also need to, it would be good to wear gloves, but just always remember that those gloves are then contaminated. So don't wear the gloves and then touch your phone. Don't wear the gloves and touch your keys. When I had to wear gloves to go in to a store or something, I only take either cash or I only take my one card. I don't bring in my whole wallet. I don't bring my phone in. I just leave all that stuff in the car so that I'm only taking in a few things. And then as soon as I get outside, I'm taking the gloves off, putting them in the trash, getting some hand sanitizer, washing my hands. And then when I get home, I am taking everything off and making sure that I sanitize everything again. Hey there, Miss Cynthia. Thanks so much for watching.
Absolutely. Also want to say hi to Kimberly Hicks. Ernestine Middleton is watching. Great information. Thank you so much, Ms. Ernestine. So Gail Smith wants to know, Nicole, what do you think is a safe time factor regarding waiting? Or I guess reopening. Reopening. Reopening, Gail. Is that what you're asking? A safe time factor regarding reopening? You said waiting. Do you mean reopening?
Or maybe waiting to patronize.
Waiting to patronize. Is that what you're asking?
I mean, I say we need to follow the numbers. So when we start seeing the numbers going down and when we don't see any increase in cases, then I think that would be a safer time. Do I know what the safe time is? No, I don't. Could there be a spike at any time? Yes, there could. But I know that while the numbers are still going up, then that means that there are still people who are asymptomatically passing this along. And so I don't know the safe time factor exactly, but I know it's not right now while the numbers are still going up.
Nicole, you made mention of gloves earlier, and I want to go back to that because that's something else we touched on Friday with Dr. Tasha Boone. You are a proponent of wearing gloves, but let's talk again about, I think people get, I don't know, maybe too comfortable wearing gloves because they'll wear them, touch everything, and then go back in the car, pick up your phone, pick up your keys. Well, the outsides of your gloves are contaminated.
Exactly.
Yeah.
Exactly. So if you are going to wear the gloves, you still need to be almost hyper vigilant. You want to make sure that you're not touching your face, with the glove on, or moving your hair, or, scratching an eye or something. You want to make sure that you're not picking up your phone, because you got to think of, if you think of the virus as some kind of, it's something that you can see, as glitter, then every time you touch something, you're leaving that glitter. So you don't want to touch anything. And then if you do, for example, yesterday, I left my card in the car. So I had the gloves on, I was getting my plants, and then I had to take the gloves off, do my hand sanitizer, then get the card, right? And I had my husband hand it to me outside the window, hand me the card, then I put the gloves back on, then I went out, ordered everything, and then I had to come back and do it all again. Yes, it means that you're going through your supplies a little bit faster, but that's what you have to do. So you have to be hyper vigilant to make sure that you are not also increasing your contamination when you wear gloves. And the hand sanitizer is just temporary. You still also need to do the hand washing with warm water for at least 20 seconds, warm to hot water for 20 seconds.
Yeah, Dr. Sanjay Gupta did a ABCs of COVID Saturday with the Sesame Street characters.
Yeah.
And he said, while hand sanitizer is great, it's the next best thing. Do not replace hand sanitizer for washing your hands, because washing your hands is so much better. He gave the great analogy that COVID is almost like it's greasy. It's a greasy germ. And he, put up a greasy pan. Would you rather, clean your greasy pan with soap and water or with alcohol, I guess, or with hand sanitizer? And of course, soap and water, because you can really get down in there. So if you are able to, have access to soap and water, definitely, but don't, depend too heavily on hand sanitizer, because hand sanitizer is the number 2 thing you should do, not the number 1 thing.
Well, and even though we are even doing the hand sanitizer and the hand washing, we still need to go back to the basics, which are don't touch your face, don't touch your eyes, don't touch your mouth especially. And then if you are going to cough and sneeze, because let's not also forget that we are in the heart of pollen and allergy season.
That's right.
Our tree pollen count was so high last week. It was crazy. So we're coughing and we're sneezing. And then if you're asymptomatic, but you're still a carrier, you still have the disease, the COVID-19, you can pass all that along. So make sure that you're, coughing into your sleeve, and that we're not touching our faces. Yes, do a lot of hand washing, but still remember the basics. Don't touch your face. Don't touch.
Yeah, I want to say hi to Pamela Banks. Thank you, beautiful, so much for watching. Also, Cynthia Watson says the glitter is a great analogy because it gets everywhere, and it does. Ernestine Middleton, we're going to get to your question in just a minute, but I wanted to say something to you, Nicole, about the sneezing and coughing in the forearm. I think that is such a generational thing, because I wasn't taught to do this. I was taught to do this.
Cover your mouth.
But I do notice, my grandbaby, he's to the fuck, he says, Tutu, you're not covering your mouth. And I say, I am covering my mouth. But this is better, because when you do this, which is what we were taught, now it's in your hand.
Right, exactly.
Now it's in your hand.
And let's be honest, when you do it in your sleeve, it's also in your sleeve, but at least you're not touching it and then touching something else.
Exactly. Yeah. You'll probably do this easier than you'll do this,
Right. Exactly.
So I do want to make sure, I want to mention that, because I think generationally we were taught to cover your mouth with your hand when you cough, sneeze, whatever. But now, of course, we know that it's better to do that.
Right. I'm waiting for someone, maybe it's supposed to be me, to come up with a song or dance that talks about, dab on them. Dab on them, right? About a cough or a sneeze. When you cough or sneeze, you need to dab on them. Somebody come up with that, okay? I'm giving somebody permission to go ahead and take it. If you don't, then I will. Go ahead and dab on them.
Superior Edwards says, hello, pretty ladies. Hello, Dr. Nicole's husband. Nice to see you.
And he's the producer. He should come up with the song.
That's right. That's what I thought about.
Dab on him.
Ernestine Middleton wants to know, Nicole, how long should we spray our mail packages and groceries? What are your thoughts about that?
How long in terms of like how many months should we spray? Or
no. I guess when you get your mail in, when you get your packages in, when you get your groceries in, how long should you spray them with disinfectant? I think that's what you're saying, right, Ernestine?
Okay. Well, we'll answer that. So if you're using like a disinfectant spray, you want to read what each spray says. Like, so for example, this one says that you need to spray until it's wet or until it's moisturized, and then you need to wait and let it dry. So for me, if I'm spraying something, it's, at least 3 to 5 seconds of spraying until I see that moisture, and then another 3 to 5, sometimes even 8 minutes until it's dry, depending on what kind of surface it is. So you really need to read whatever you're spraying with and read what the recommendations are from that company, because each company is a little bit different in terms of how it should be used. So you need to read and see what you're spraying it with. In terms of your groceries, you just need to really make sure that take it out of the bag. That's what I'm remembering to do, is take stuff out of the bag, and then you're spraying down the packages. And then you can even, some people I've seen, and it's been recommended to, like fruit that comes in like those containers, take the fruit out, go ahead and rinse it off, and then put it into your own container at home.
Yeah. So you do recommend spraying the mail, spraying any packages, and spraying groceries, because some people, have said early on that you shouldn't. And I think more physicians, medical professionals are saying yes,
that we should. Yeah. And so even like packages that come from that are being delivered, your Amazon packages, whatever. So I'm letting those sit outside, either in the garage or out on the porch for a little bit, for at least a day, and then I'm spraying it down when you get it, and then let it sit outside before I'm bringing it into the house, or at least I'm opening it up outside and taking my whatever I ordered and bringing that in. But in terms of packaging, because you don't know whose hands and who was touching those packages, and I mean, understand that the virus COVID-19 needs a live cell to stay alive, but we don't know what kind of cells were they sneezing on it. So were there some respiratory droplets on it? Were they just touching it? Since you don't know, just treat everything as infected. I think if everyone were to treat themselves as positive of having it and treat everything as being dirty or contaminated, then I think we would be a lot safer, right? In terms of how we would deal and handle things.
Yeah, just make believe everybody's got cooties. Remember when everybody had cooties? So listen, I get what you're saying. I totally understand what you're saying, but I do want to know, so how long does it live? How long does it live on a surface? Does it depend on the surface?
It depends on the surface. So we're seeing that different types of surfaces, it lives for different types of time. So in the air, we know it can stay alive for 2 to 3 hours in the air. Yes, Miss Queen, it is hard. It is hard to remember there.
Yeah, it's hard to remember that. Yeah.
So, but maybe if we had a song, Mr. Superior, we can get that done.
Well, and Maxine says she told Superior to write it. Hey, Karen Alexander, thank you for watching. But so I guess Karen says we can help with that. With the song, I'm thinking Karen says a song. Well, maybe Superior and Karen can work on that.
Come on, Karen.
And Karen, maybe some of the characters can work on that.
Yeah.
I love that.
Yeah.
That's very apropos right now, because that is such a big thing. I think it's generational. We were taught to do this, and this is just so much safer to do. Hey, right. Shana Boston, thank you, beautiful, so much for watching. But you were saying, and also Carol Penn says, hi, Dr. Nicole.
Hey, Dr. Carol, how are you?
So
good to see you.
Yes.
So on plastic surfaces, such as light switches, your phone case, any kind of plastic surfaces, we know that it can live 8 to 9 hours. So And then copper, we know it can live days, like 2 to 3 days. So it really just depends on the type of surface it is. But if we can, like I said, treat everything as if it's contaminated, think of it as glitter. If you just think of everything is covered in glitter, you don't want to touch the glitter. You know how hard it is to get glitter off of you? Like, it's crazy. So think of it like that.
It is. Maxine Moses said, wash fruit in 1 part vinegar, 1 part water, and pat dry, and then put it up. Fruit lasts much longer that way too. Vinegar and water.
Does. Yes, it
does.
Mm-hmm.
All right.
It does.
All right. So this is Dr. Nicole Edwards with on Coping with COVID. I'm Tre Tailor. Thank you so much for joining us. Norris Garner says, always love Tre Tailor. Blessings to you, my friend. Thank you so much, Norris Garner. Where are you now, Norris? Are you in DC? Superior is going to do it. All right, Superior and Karen. We want to see this song. I don't know if we want to call dab on it or we can go COVID on it or I don't know what, but I'm looking forward to it. Me and Nicole can sing background vocals.
There you go. There you go.
Lamar,
y'all didn't know me and Tre used to sing. I used to sing background for Tre's group. So
you were a lead vocalist too. Stop the madness. So we all were in a band together. Let's say that. Queen Shannon Nicole says, thank you, ladies. Thank you so much. And Lamaris Boyles, thank you so much for just cheering us on, for giving everybody this information. So Nicole, there are some new symptoms I want to talk about because there are some testings. I do want to shout out MUSC is going to be in Columbia tomorrow doing some testing for the 29203 zip code. They're going to be in Eau Claire tomorrow doing free testing. Follow my page so I can give you more information about that. But there are some new symptoms. So I know at first they were saying fever was a symptom, and then of course the cough. What are some of these new symptoms that they're finding out?
Okay, so we know fever, we know cough, and we know shortness of breath. Those are the 3 that we were all hearing about and scared about. Yeah. But we're also seeing that along with the fevers, we're also seeing chills. Okay, and then rigors. Rigors mean, like, have you ever had the chill so bad that you're actually shaking?
You're shivering,
so rigors are like, it's almost violent shaking or rigors.
Wow.
We're also seeing headaches and body aches and muscle aches. Okay, so almost like flu-like symptoms. And then we are also seeing, hold on, because I'm actually going to pull up the CDC. The CDC actually has
what I read. I'll tell you what I read. Hallucinations. I heard about hallucinations.
Okay. Well, let me give you the CDC. What's on the CDC site first, and then I'm gonna tell you what I know. Okay, outside of that. So the CDC, their list, we knew about the like you said, the cough, the shortness of breath, but now they've added chills, the rigors or the shaking, muscle pains, headache, sore throat. Okay, and then a loss of taste and smell. Okay, loss of and that's a really big one. So a friend of mine that had it, she realized that she had it when one of her refrigerators in the house went bad and everybody else in the house could smell it and she couldn't, right? And then, so that day she couldn't smell. And then the next day, now she had a little bit of a sore throat, but she had thought, okay, maybe that's just from allergies and postnasal drainage, right? But then she lost her sense of smell and then she started with the fevers and then the chills and then fatigue. That's a really big one. Fatigue, almost like you just want to sleep all day. But you really shouldn't. The body aches. She said the body aches were horrible. And when you get body aches and the shivers, it's really bad combination. And then another symptom that we've been seeing that is not quite on the CDC list yet is gastrointestinal symptoms. So diarrhea. And it's like watery, uncontrollable diarrhea. It's horrible. Nausea is another one that we're seeing. So you don't feel like eating, you feel sick to your stomach. And then, so the nausea, the diarrhea. So like I said, it almost feels like flu-like symptoms, like I said, you don't want to eat, you got a sore throat, you're coughing, but you got the shortness of breath, you've got the fatigue, you've got the chills. But we're also seeing that they haven't been, they are doing a little bit more talking about now is what we're seeing. It's what we call in the medical terminology, we call it microvascular symptoms. So it's where the small blood vessels are getting clots. We're seeing clotting in the small vessels. So I think you've heard of the COVID toes. Have you heard of that? So COVID toes, they're getting these bluish purple lesions, or it almost looks like bruising on the toes and on the tips of the fingers, right? And so what it's coming from is those small blood vessels in the tips of your fingers. In medical school, we learned it as fingers, toes, and nose, and things that kind of hang. So your fingertips at the very tips. So they're not getting good blood supply because they're getting clotting, and we're seeing clots happening. So what else causes clots, or what else do clots affect? They cause strokes, and they cause heart attacks.
Your circulation.
Your circulation, right. And so initially when this was coming out, we were seeing some younger people, like, 30s to 50s, and they were coming in with strokes. No history, no family history, but all of a sudden they're coming in with these strokes, and we're like, well, what's going on? They tested them for COVID, and all of them were coming back positive for COVID. And so now in the medical field, what we are learning is no matter what people are coming in for, go ahead and test them, because this is affecting all areas of the body. We know that it can affect the kidneys. We know it can affect the lungs. We know it can affect the GI tract. It can affect the vascular system. It can affect every place, because this inflammatory, or the inflammation, causing what we call a cytokine storm, which is all the inflammatory cells just coming and rushing in. And so it's causing all these variety of symptoms. So we're learning now, test everyone, because it might be this atypical presentation of COVID. And I have a feeling, and the CDC has already said it, they're going to be updating this list more and more, because we're seeing new symptoms coming out almost every day.
Wow. And I guess that's because the more people get it, the more, because it's still new. It's still very new.
It's still very new.
And Nicole, isn't that why you are such a proponent of waiting?
Yes, because you might think you don't have it because you don't have shortness of breath and because you don't have a cough. But what if you have other symptoms that you attribute to something else? But you might, then are you truly asymptomatically carrying it? Not necessarily. You might be symptomatic, but just not the symptoms that you are aware of. But yes, that's exactly why I'm a proponent of just everybody stay at home. Stay at home. Just a little while longer. Just a little while longer.
Yeah. Nicole Edwards, Dr. Nicole Edwards is with us today on Coping with COVID. We're talking about the dangers of doing too much too soon. She also just updated us on the brand new symptoms that have come out. Chris Cuomo, the anchor at CNN, he mentioned this hallucinations, and he's still out. As a matter of fact, both his son and wife ended up getting it from him, but he said he had hallucinations and also the shivers. So
and we can do a whole nother show on what you're supposed to do if you get symptoms, and then for how long you should do it. But you really, because you can pass it along to other people in your house, you really should be isolating even from people in your house, right?
Yeah, but Nicole, that's so difficult. Because I was talking to a friend of mine the other day, and he and his brother live with their mom, and their mom is elderly. So what happens if one of them get it? First of all, if anybody in your house gets it, you may have it anyway, right? Because y'all been living together the whole time.
Exactly. And you might just be one of those asymptomatic people that aren't showing the signs of it, or it might be so mild that you didn't even attribute it to it. And that's why we're seeing such spread, is because people don't even realize that they have it. Then they go out and they go to the drive-through, and they're, coughing on their money, and then they're handing it to the drive-through lady, and then she's taking it, and then yes, that's exactly why it's spreading. So if anybody, that's why I said if we all treat everyone like we all have it. But yes, so how do you isolate? You would have to stay in your room.
How do you isolate? Yeah.
You have to stay in your.
Okay, but when you got to eat, because here's the thing, like with Oprah told Stedman he had to go out to the guest house. Now we all don't have guest houses.
We don't have guest house. I don't have a guest house. I haven't made it there yet,
Right. So you've got to feed that person. And I guess idealistically, that room needs to have their own bathroom too.
Right.
If
they can, if you have a house that has more than one bathroom, right?
Yeah.
But yes, so a friend of mine that had it, she basically stayed in her bedroom. Her husband and the kids stayed on the other side of the house. They would come and bring her food, leave it there at the door, and then she would open the door and take the food into the room. But she did not come into the room. And that's really hard to do when you have kids, right? Because kids want to hug you. Kids want to know that you're okay, but you've got to isolate because you don't want to potentially even spread it even more. The risk is already there because they're in the house, but you gotta isolate and stay away.
This is another show, Nicole, and we were talking about.
I told you that's a whole other show
and how to self-isolate. But I wanted to piggyback on what you said. Okay, so you bring the person their food, but then the food goes in, and the plate and the utensils goes into an infected room. Do you pick that plate and knife and fork or do you do paper plates so they can just throw it out?
Yeah, try and do as much disposables as you can.
Because you don't want that infected knife, fork, anything to come back out.
Right, exactly. Right? Disposables if you can.
Yeah. Norris Garner says, wow, good information. Thank you, Norris. And Alexia Gaffney says, stay home. Just stay home.
Dr. Alexia, infectious disease specialist extraordinaire. You need to have her on the show, Trey.
I would love to. Alexia, I'm going to ask Nicole to connect us so that you can come on. Maybe she can help us with one of these 2 shows. We're already talking about a show on how to deal with your children, where we've talked about some younger children who don't know really how to articulate their feelings or having some behaviors about this. And also, Alexia says, hey, Doc. And also now I really want to do this, how to self-isolate successfully. Self-isolation one-on-one. We're going to do that real soon here on Coping with COVID. So, all right. So we talked about doing too much too soon. We talked about the new symptoms. Any other updates that you can provide for us, Dr. Nicole?
I just want to let you guys know, because you brought this up, that MUSC is coming to do testing. Yes. And I love the fact that they're doing testing in the 29203, which we do know that is I love the fact that they're doing testing there, right? Yeah. I'm trying to stay political here.
Well, no, let's say it because, and you mentioned this earlier, and I wanted to say it when you talked about some of the southern states that are opening up, and disproportionately they are African American, and we do know while African Americans are a small number of African Americans are getting it, but a high number of African Americans are dying from it.
Yes.
And it's because we're the ones with a high blood pressure, diabetes, we're, smoking, drinking, and everything. I mean, and we don't have, traditionally access to healthcare.
Right. And then if we're just going to be all the way honest, we're not always believed when we do come in with complaints. So the reasons why that there is, thanks, Dr. Alexia, why maternal death is higher, maternal fetal death rates are higher in African American communities, because we're coming in and we're complaining of, the preeclampsia symptoms, and they're just sending us home. Same thing, we're seeing that a lot too with African Americans. They coming in with the coughing and with the, hey, Dr. Delicia, thanks. We're coming in and we're seeing the African Americans, and they're just being sent home, and they're, what do they say, crawling in on a wing and a prayer and dying basically before they're relieved with their symptoms. Mm-hmm. So I am glad that they're going to do testing in the 29203. But my concern with this, especially with our people, with our African Americans and with us, is that if you get a negative test, that does not mean that you can then go out and party hardy and get your hair done and go to the party and go to the beach. Yeah. Okay, because I can test negative for it today. First of all, it's a 30% false negative rate. Okay, 30%. So you might test negative, still have it. Yes.
And why is that? Let's stop there, Nicole. Why is that? Why is it that you could test negative and still have it? Are you saying you could test negative and get it tomorrow? Or are you saying the tests are wrong?
Both. So I have a whole handful of friends, doctors even, that tested negative, but had the symptoms I just told you about that my friend had. She's a doctor. Okay, she's a doctor. Her test was negative. Right. But I promise you, she had the shortness of breath. She had the fatigue. She had the GI stuff. She had the cough. She had the high fevers and the rigors and the fatigue and the headaches and all the things. But her test was negative. We do know that there is a 30% false negative rate. Sometimes it's because the test is not done correctly. So if they don't get far back in this swab has to go all the way, into your nose, and it comes all the way back into the back of your throat. So if they're not getting it down deep enough, then it might come back that you don't have it, but you actually do, right? And even if they do get it down deep enough, it still is not 100% sure. It's not like no test is 100% sensitivity or specificity, right? So there are false negative rates, and we know that. So I don't want people to hang their hope on a negative test. And that's also what you said, Trey. If it's negative today, you can still get it tomorrow. Right. So I don't want you to get a negative test and then be like, oh, I'm free and I'm clear. Let me also say this. You can be positive today, right? And then be one of the, I'm so glad that there are people who get it and then survive, and that they're living and that they live to tell the story, right? But that doesn't mean that you can't get it again.
Yeah.
All right. And we are seeing that if you look at the rates over in Wuhan, China, where this all started, we're seeing where people are getting reinfected. And the real deal is we don't know how long this immunity lasts. So once you have it, we don't know how long your body is immune to it. And just because you're immune to it, it doesn't mean that you can't get it again. Think of it like the common cold. You can get a cold multiple times in a season, right? The coronavirus is a cold is a type of coronavirus. So we don't know yet if this coronavirus, we're assuming that it's like a common cold as well, but you can get it multiple times. So I don't want you to hang your hat on a negative test. Yes, it'll be good to know who's positive.
Yeah.
But I don't want you to think that just because you're negative, it means that you're in the free and the clear. You still need to do all of the precautions, all of the hand washing, all of the social distancing, all of the staying at home, everything that you would do as if you were still positive.
Because you are probably negative because you have been doing the right thing. So that doesn't mean, of course, you should let up on what you've been doing. Continue to do it so that you can stay healthy.
Right, which is my concern with opening too soon. I think our numbers aren't quite as high as they could be because we have been social distancing. But if we rush into reopening when we still see the numbers are going up, then they're just going to go up even more. Remember the whole point about flattening the curve? We did flatten it, but just because it comes down doesn't mean that it can't go back up. Right. We don't want it to go back up, y'all. We don't want it to go back up.
Dr. Tasha Boone talked about that Friday too, Nicole. She said, this is not the time you want to be sick. You want to keep your health as pristine as possible. If you're on blood pressure medicine, take your medicine. If you're on diabetes medicine, take your medicine and don't eat that chocolate chip cookie. You know what I'm saying? She's saying, you know, and I even said, you know, I made a joke. I said, if you are riding a bike, make sure you got your helmet on. Don't get sick right now.
Listen, every parent, I'm sure, has said this. Stop jumping on that. We can't go to no hospital right now.
Right. Well, and her point was the health care system was already strained, and it's even more strained now.
Right.
So this is not the time. But she also did stress, but if you need to go
please go. And now that what I just tell y'all, because we're also seeing that our numbers of strokes and heart attacks have gone down. And I don't think it really has gone down. I think people are just afraid to go to the hospital, right? But because we also know now that the inflammatory markers and the microvascular disease that can happen and the clotting that can happen if you do have stroke or heart attack symptoms, please go into the hospital. Please get it treated, because if you're not getting it treated, that can have detrimental long-term effects in the future and for your future.
Well, I'll tell you, when we were talking to Tasha Boone, Dr. Tasha Boone Friday, the person who said that she ignored her doctor's orders to go to the hospital is your friend Valicia Adams.
Oh Lord.
Yeah, Valicia said,
no, I'm gonna call her right now.
You need to call her. So definitely don't get sick, but if you are sick, go on to the doctor.
Please go to the doctor. Please, please.
30%. Wow. Queen Shannon Nicole says 30%. Wow. And I say that too. Yeah, 30%. So, you know, obviously get a test done if you're able to get a test. And again, they are going to be doing free testing at Eau Claire High School tomorrow, MUSC is, but still continue to wash your hands, wear your mask, wear your gloves, stay home if you can. And just be careful. Be careful.
We have to be careful. And that's the biggest thing. We have to be careful.
Because it's still so unknown. Everything is still so unknown.
We're still, day by day, we're getting new updates and learning. I mean, I get probably 20 emails a day from all kinds of health organizations giving me the latest update. And it keeps changing.
Yeah. Dr. Nicole Edwards has joined us today on Coping with COVID. Great information on updates, the new symptoms. Let's go over those symptoms again, Nicole, because like I said, at first we heard about shortness of breath, coughing, and temperature. but there are new symptoms. If you didn't hear Nicole, please hear her now. What are some of the new symptoms, Nicole, that are coming out?
I'll give you the CDC symptoms first, and then I'll tell you the all of them. So the CDC has added chills, shaking chills, muscle aches, headache, sore throat, and loss of taste or smell.
Symptoms. If you have these symptoms, please go
and get checked immediately. Right. And then additional symptoms, if you are seeing bruising on your toes or your fingertips, this purplish, bluish kind of bruising, they're calling COVID toes. That's a big one. And typically with the COVID toes, those microvascular, we're seeing that happen 2 to 3 days before the other symptoms happen. So it's almost like those symptoms come first and then come the other symptoms. But we're also seeing GI symptoms. So diarrhea is like a watery diarrhea, and nausea, and then a loss of appetite. And then, like I said, fatigue, and then chest pain and stroke symptoms. So heart attacks, chest pain, palpitations, and then stroke symptoms. So of course, if you have garbled speech or weakness in one side or the other, or not able to move like you used to move, then those could be signs as well that we're seeing.
Dr. Nicole Edwards, thank you so much for joining us. If people want more information about you and your practice, because you are taking patients, please let us know how to do that.
Yes, so you can follow me on all social media platforms. The handle is Dr. Nicole D.O. That's DrNicoleDO, as well as drnicoledo.com. And if you want to contact me, you can do that through all the social media platforms or also through my website. So Dr. Nicole D.O.
All right. Nicole is going to come back with us later on in the week. She's going to tell us about how to talk to your children and be conscientious about some of the behaviors your children may have. And you're thinking maybe they're acting out, but maybe they're just having a hard time adjusting to being home with you all day.
Yeah, absolutely.
And then we're going to get Dr. Alexia Gaffney on. She's with infectious disease. And we're going to talk about self-isolation 101. Because if you do have COVID-19, if you do have the coronavirus and you do need to self-isolate, we want to tell you the best way to do it. Because, you know, like I said, you know, Stedman had to stay out in the guest house. If you don't have a guest house, we need to, let's all stay at the house together, but we need to figure out how we're going to stay at the house together and everybody don't get the coronavirus, right?
Right, exactly.
So we're going to coordinate with you, Dr. Alexia, and do that show also. As always, I always lead with this day's Jesus Calling. Today is the 27th of April. This is my favorite prayer journal, and it's always so timely. If you would allow me to read, "Come to me with empty hands and an open heart." This is Jesus speaking, "ready to receive abundant blessings. I know the depth and breadth of your neediness. Your life path has been difficult, draining you of your strength. Come to me for nurture. Let me fill you with my presence. I am in you, and you am in me. My power flows more freely into weak ones, aware of their need for me. Faltering steps of dependence are not lack of faith. They are links to my presence." So if you're feeling down and confused, Jesus is still the answer. Jesus Calling is available because people have been asking me on all sites. They actually do have a Jesus Calling website on HarperCollins. I go to Thrift Books, but neither one of them are paying me for anything. But I am going to try to get some Jesus Callings to give away. So hopefully we can do that. My name is Tre Tailor. This is Coping with COVID. Please continue to follow me on my page. Both of my personal pages are full, but please like and share the Tailor Made Productions page and also Tre Tailor page. Please continue to like and share this post so more people can get this great information. Now, tomorrow, if you live in Columbia, South Carolina, or Richland County, and you have a small business, you want to listen up. Shaquise Newton, the city councilwoman for this area, is going to tell us about the $500 billion the city and the county has allocated for small and minority businesses. She's going to tell us about that and what you need to do to get access to some of those funds. That's tomorrow at 2 o'clock right here on Coping with COVID. And then on Wednesday, we're going to talk talk with national thought leader and best-selling author Marianne Williamson. If you are a Marianne Williamson fan or follower, you won't want to miss it. That's this week on Coping with COVID. Want to say hi to Queen Shannon Nicole. Yes, girl, Jesus calling. I hope you're reading yours. Delicia Hayes says, great job, Dr. Nicole. And Terrence Jamie Harris says, awesome conversation, ladies. Great information. Thank you all so much for joining us on Coping with COVID. I'm Tre Tailor for Dr. Nicole Edwards. We wish you peace and abundant blessings. Be safe. Stay well.